How much do you know about this controversial nutrient? When L-carnitine was first introduced to China, it was so popular that many people regarded it as a fat reduction weapon. However, shortly afterwards, there were many people who began to criticize it as an IQ tax. Can controversial L-carnitine reduce fat at all? Is it true that L-carnitine has no effect? Please subscribe to me to learn more about health. First of all, let's understand what L-carnitine exactly is. As yet, people's first reaction when mentioned L-carnitine is a diet pill. However, Professor Li Dua, Department of Food Science and Nutrition, Zhejiang University said, L-carnitine is an active substance in the human body and an amino acid that facilitates the conversion of fat into energy. It is essentially a multivitamin that the body can synthesize on its own. Therefore, L-carnitine isn't a diet pill. Its physiological function is mainly to promote the beta oxidation of fatty acids. It acts as a vector in the form of acylcarnitine to transport long-chain fatty acids from the outer membrane of the mitochondria to the inner membrane and to metabolize and convert fat into energy within the mitochondria. Meanwhile, it is also involved in the transportation and excretion of other acyl group to avoid metabolic toxicity caused by acyl group accumulation in the body. Since L-carnitine is a significant part of fat conversion, does that mean it can be used for losing weight? Chao Jianmin, director of Sports Nutrition Laboratory in Beijing Sport University, believed theoretically, if the fat burning is affected by the lack of L-carnitine, it can play a role in losing weight with exercise. Whereas, fat burning is a complex process. In order to decompose fat, L-carnitine firstly should transport the fat from the subcutaneous tissue to the mitochondria, then conduct oxygenolysis. There are many factors involved in this process. L-carnitine just acts as a fat carrier, but it is not the only influencing factor. So, the effect of L-carnitine on weight loss has yet to be proved. Furthermore, for now, there is no very specific data on the anti-obesity effect of L-carnitine. Does L-carnitine with ambiguous anti-obesity effect still deserve to be trusted? We mentioned earlier that L-carnitine is a compound made by the body itself. So, in normal case, self-synthesized L-carnitine is able to meet the body's needs. However, for L-carnitine transport system obstruction due to genetic defects, or in a particular case, such as the use of certain antibiotics leading to the body's absorption rate of L-carnitine decreased or excretion increased. Both cases require additional L-carnitine supplementation. In addition, research shows that L-carnitine may have positive effects in cardiovascular and cerebrovascular diseases. A large double-blind control experiment involving multiple sites in Italy enrolled 2,330 patients with acute anterior wall myocardial infarction to carry out experiments. It was concluded that for patients with acute anterior wall myocardial infarction over 2 months, although L-carnitine therapy couldn't reduce the risk of cardiac failure or the recurrence of myocardial infarction, it can reduce the death rate by 27%, ventricular arrhythmias by 65%, and stenocardia by 40%. Of course, there are also some scholars have objection for long-term supplementation of L-carnitine has positive effect on myocardial vessels. However, technology is constantly advancing in improving the body metabolism, reducing neuropathic pain caused by diabetes, or protecting the cardiac system. People will find a better possible way to care health by taking full advantage of L-carnitine in the future through continuous researches and studies. Please subscribe to me to learn more about health. I've been engaged in science popularization for 19 years. Please give me a like, subscribe to me, and forward this video if you like it to introduce more people with the health knowledge.